So as we head into Nurses Week, we thought it was perfect timing to talk about nurse engagement and finding joy in our jobs. I've been lucky to have worked in the same infertility center for 15 years, but I realize that I'm often the exception and that nurses are leaving their jobs, some in the first year, for many reasons, burnout being one of them. We're so grateful to have Elizabeth Scala, an expert on promoting nurse engagement, with us today. And she's going to discuss some strategies and small tweaks that we can use in our everyday practice to enjoy our work days more. So hi, Elizabeth. Thank you so much for being here with us today. Just a quick introduction before we get to the meat of this. Elizabeth is a Johns Hopkins trained RN, best-selling author, keynote speaker, and consultant on burnout prevention for nurses in all specialties. She is the CEO of ElizabethScala.com. Her website is here on the slide, and the founder of The Art of Nursing, a Nurses Week program providing education and inspiration at dozens of hospitals and healthcare organizations across the country. She has an online community of over 15,000 nurses, and her articles are frequently posted on many different healthcare websites. She is also a Reiki master, certified coach, holds a Bachelor of Arts degree in psychology, a BSN and master's degrees in both business and nursing. So welcome, Elizabeth. Thank you so much.
Thanks for having me. I'm super excited to be here. This is going to be great.
I'm so excited. So can you talk about nurse burnout with us? How pervasive is the problem? Maybe what are some statistics if you have them?
Sure. It's a great question, and actually one more addition to that bio you just shared. I'm also a research program coordinator at a large academic center in Maryland, and in that role, in working and helping nurses with evidence-based practice, quality improvement projects, and research, I do realize that sometimes the nursing literature is a little slow to catch up with the sort of problem. And the reason I speak to this is before getting into my book, Stop Nurse Burnout, there was a physician, Dr. Dyke Drummond, who authored Stop Physician Burnout. And then he had so many nurses in the audience when he was giving his talks or helping people at workshops, and they were asking for a nurse book and a nurse information. And so we teamed up to work on that project. And in doing so, I did a lot of searching of the literature, and I continue to do so. I actually have a nurse burnout Google alert set to my phone, so when anything new pops up, I get that information. But the reason I'm prefacing all this is sort of the physician literature is much more established, and the prevalence rates are published. In nursing research, there's a little bit of limitation in that we lack some of that evidence. However, it has been catching up, and the one thing I will speak to, though, is that the prevalence rates are kind of all over the place. It depends on where the study was done, what population they were looking at, maybe the sample size. So some of those methodologies, and I don't want to bore your audience with research, but some of those methodologies and the limitations of the studies kind of limit the scope of prevalence. I will tell you, though, there is one study that's sort of more of the landmark related to this, published by Linda Aiken and her colleagues in Pennsylvania. And they looked at nurses in 3 different states, in California, New Jersey, and Pennsylvania, in large organizations. And they actually had a statistician, a cost-benefit analysis, lots of different projections related to retrospective and prospective. And they did find in that publication, which was published in Health Services Research, that about 1 in 3 nurses experience nursing burnout. I can tell you, though, as of last fall, so 2017 in the fall, I got one of those Google alerts to my phone about nurse burnout. The American Nurses Association has an online magazine called the American Nurse Today, and in that publication they surveyed close to 2,000 nurses, and I'm just looking at the stats here on my phone. They found that 79% of nurses know someone has left nursing due to challenges relating to balancing work and life. 51% of nurses say they are seriously considering leaving their job in the past 6 months. And 65% of the nurses who responded say turnover is related to burnout. So while the literature kind of gives numbers all over the place, that's the most up to date. So you might find someone say 1 in 3, even getting closer to 1 in 2 nurses being burned out.
Pretty impressive. So I guess the opposite of burnout maybe would be nurse engagement, which I define as being really emotionally invested in your job. So not just staying in it, but really enjoying it. How do you define it, and is this actually possible in your opinion?
I think you're spot on with that definition. In fact, burnout actually came to be when a woman named Christina Masloch was brought into an organization to study employee engagement. And it wasn't actually first with the nursing population, it was just employee engagement, right? And when her and her colleagues went in to study and look for engagement, they found the opposite, which is burnout, now come to terms. And the three main components that they measure in their Masloch burnout inventory are related to exhaustion, personal dissatisfaction, personal, the feeling of being cynical or venting or complaining. Compassion fatigue is lumped into that category. And the third being an underwhelming sense of personal accomplishment, meaning, I'm not feeling appreciated. I go home and throwing my hands up in there. What's the use? Did I even make a difference today? I've been so rushed with my patient load that I see during my shift. So you're definitely spot on that engagement is the opposite of burnout. And that emotional exhaustion, that physical exhaustion, that sense of accomplishment or lack thereof are all really tied up into that. And I can tell you from personal experience, so I hope I don't scare the audience, I'm in a little bit of burnout myself related to my work online, not related to my research job. I am loving that, but related to my work online, I'm burning out myself. And what I notice is when that happens to me personally, I do kind of detach and I do kind of set myself like away from my work and like kind of tune out by trying to do other things that I might find enjoyable. So that emotionality, that mental and emotional health is certainly wrapped up into both burnout and engagement.
Sounds good. So we need to take care of ourselves before we can take care of others.
Absolutely.
So I have a business where I'm a nurse educator, and I go all over the country and notice a need to improve nurse satisfaction at all levels. So there's the novice nurses who feel overwhelmed. There's the experienced nurses who may need to be a little bit more challenged. Can you discuss some simple strategies for both ends of the spectrum?
Definitely. Monica, this is a great question. So we'll start with the less experienced novice nurse, even fresh out of nursing school, maybe even in residency, an orientation program, that kind of thing. I was reached out to a nurse from 4 months experience, emailed me and said, Elizabeth, my goodness, I go home from work and I just can't stop thinking about it. Elizabeth, oh my goodness, I'm worried. It wakes me up in the middle of the night. I think about, did I miss something for my patient or forget to report something to my colleagues? So totally normal. And the strategy for that would be what I talk about in Stop Nurse Burnout related to boundaries. Because what's interesting is, so you see me here talking to you, and I am Elizabeth, the human being. I'm wearing my lone wolf t-shirt. I'm in my home office here, and I'm Elizabeth, the human being. When I go to work, it's very interesting, but I look very similar. I just might have different attire. I'm Elizabeth, the nurse. So it's hard to separate those two. So the strategy I would recommend, and we have a great role model for this actually with Mr. Rogers, because what does Mr. Rogers do? He comes into our living room, he changes his shoes and puts on his sneakers, he changes his overcoat, puts on his sweater, and he sings a song about the neighborhood. He separates his work from his life. So what I encourage people to do is when they are in that commute, like if you're riding a subway, if you are a biker and you bicycle home from work, or if you're driving your car, whatever the case may be, when you get to the house, when you get to the threshold, maybe of your apartment door or what have you, you pause, you feel your feet to the floor, you take a deep breath in, and as you exhale, you say to yourself, or you can say it out loud if no one's out there listening, with this breath, I'm coming all the way home. And it works when you use that. It really does. It works when you use that. So you breathe, you inhale in, you pause, you exhale, and you say, with this breath, I'm coming all the way home. And you tap that into whatever that boundary is of you separating leaving work and coming home. Does that make sense?
Yes, absolutely.
Okay.
I've read about thinking of being grateful every time you cross a threshold. So it seems like compartmentalizing in terms of balancing home and family is the way to go.
Mm-hmm. And it really, you have to, for this particular strategy, match it with the breath, say the saying, take that pause, because otherwise your brain, your body, the physical, the mental, emotional is still going to be wrapped up in thinking about work. So saying that mantra, so to speak, with this breath, I'm coming all the way home. So now on the other flip side, for the more experienced nurses, those folks who are seasoned nurses, been in the field for a long time and still looking for some ways to not feel so overwhelmed with work. I have another great example for this related to, I like using a yes-no balance sheet. I call it a yes-no balance sheet. So let's use an example of work calling you in for an extra shift. Not related to your on-call. It's not the mandatory call. But if they're just calling, looking around when they know, you're home, we'd like to come in here. So let's use that as an example. So you take a piece of paper, a blank white sheet of paper, and across the top we would write work calling me in for extra shifts, right? And then you draw a line down the middle of that white piece of paper. One column on the right is yes, one column on the left is no. Now, when work calls, again, these are not the mandatory call shifts where you're scheduled to be on call, but this is that extra stuff. Once in a while, we want to go above and beyond. We want to say yes because we're team players. We want to say yes because maybe we know something's coming up where we're going to need a switch. We want to say yes if we need to pay off, a debt where someone helped us out in the past. So that's fine. I'm not saying don't say yes. What I encourage people to do is use that balance sheet, like keep it on your refrigerator, keep it near your phone, whatever the case may be. And each time work calls for you to come in an extra 4 hours, an extra 2 hours, an extra shift on the weekend, whatever it is, check off in that, yes, no, and make sure you're balancing between the yeses and nos. Again, I say yes myself. We're all nurses. We want to help each other out. But we also need to say no from time to time, which means we're actually saying yes to ourselves. So again, that's my example of work calling. But think about, as a nurse, like, what do you have trouble saying no to, or who do you have trouble saying no to? Maybe it's getting put onto another committee and doing more project work. Maybe you need to kind of balance out yes and no's there. So Monica, how's that one for the more experienced folks?
I love that strategy. And I think sometimes the visuals are what we need to really realize that we're saying yes a lot more than we think we are. Mm-hmm. Love that. So research indicates that managers, so nurse managers, have a big responsibility when it comes to creating a culture that promotes nurse engagement. People might decide to leave or stay according to the competency, personality, et cetera, of their nurse manager. What are some small tweaks? So not big overhauls, but little everyday shifts that nurse leaders can do to improve this in their practice?
This is a great question, and I love it because the manager spectrum can be all over the place, where you have an experienced manager who has built rapport with her team. You have a new nurse manager who he's maybe feeling intimidated by his team, all over the place. So the first thing, which you mentioned, Monica, a small tweak you can do, is just check in with folks. And I actually show a slide during my burnout presentation. It's a graph, a stress severity and duration graph. And actually, when we're pushed a little bit, think about it. Adrenaline in the emergency department, got to save a patient during a code. A little bit of stress actually helps people produce and be more productive. But when that stress gets pushed too far and people sort of fall off the right side of that bell curve, that push in stress makes the productivity go down and the work outcomes go down, and so safety goes down. So a nurse manager just needs to check in, maybe in a morning huddle, maybe one-to-one if there's time to check in with each person, but if that's not optimal, then as a group, and just give them sort of even maybe based on the FACES scale, the 1 to 10 severity scale that we use in like pain scales and stuff. Ask them to point, like, where are you feeling today? And then hear that feedback, because sometimes you can push them a little bit harder if the case may be, because that stress, again, is going to help productivity. But sometimes it's not the time to ask for the next, scheduled staff meeting to occur that afternoon. Maybe it's not the time to send that next email that's asking the staff to do something else. So really taking that pulse of your staff, but not only taking the pulse, hearing what the feedback is and responding appropriately.
That sounds great. So again, using visuals to underscore, a cerebral concept that maybe we wouldn't be able to verbalize otherwise. And the stress bell curve reminds me of when they talk about studying for tests when we're in school. Like, there needs to be some sort of impetus to study, but you get to the other end of the curve and you just forget everything and blank out on the day of the big test.
Absolutely. Nobody should be studying like the night before.
That's right. And you did bring up compassion fatigue earlier. We mentioned it. So our patients in infertility are incredibly stressed, and research supports this, due to the lack of control and the perceived sense of the loss of a dream, so to speak, which is achieving a pregnancy for many of them. How, as RA and nurses, can we be empathetic but protect ourselves without experiencing compassion fatigue?
Mm-hmm. Monica, this is such a good question, and I do commend everyone out there watching and listening in the audience, because my background before I got into the work that I do is in psychiatric nursing, so I kind of always joke, I was never the nursey nurse, I'm afraid of all the tubes and things, so I always love hearing about what others do. It's just so amazing to have nurses working in such ways. And that being said, as you mentioned, I was actually on a call today being interviewed for an article that'll be coming out about similar topics, of course, and they asked similarly about feelings and emotions. And I said, first of all, we have to remember as nurses, like, before we're a nurse, we really are a human being. Like, we are humans with feelings, with thoughts, with emotions, with hearts, with our own desires, with our own whole human natureness. So while we have to remain sort of stoic or have that kind of affect that's professional and keep our professional boundaries, we need to realize that having emotions is realistic and we can still have them with empathy. So in the role, when you're in the nurse role, you're being professional, you're having those boundaries, you're taking care of patients. But when that's over, instead of putting your head down and just pushing through to the next patient or the next assignment, if it can't even happen that day, maybe later in the day, going home and journaling about how you feel, writing even a non-send letter. Maybe you're sending a letter to the patient that you were working with, or to the experience that happened, or to your management. And you're never going to send this letter, but you're going to get that emotion. You're going to get maybe frustration. You're going to get sadness. You're going to get all of those feelings that come up out. You need to get the emotions out in a safe way so that you can keep coming back to work and not get fatigued by the emotionality that's very real to have as a human being. So journaling is a great way. If you need to go to professional counseling or therapy, I've had therapists in the past myself. It's helpful to be able to talk about the real hard work that you're seeing and experiencing. You can't just stuff it in, because what happens when we stuff it in is we blow up and implode. So I do feel that the emotions need to come out in some way.
It sounds like a lot of these strategies are creating a pause or sort of a space, creating space between the stimulus and the response. So whatever method that is for doing that might help just in terms of self-care. Mm-hmm. So great. So you mentioned your book and your course. Can you just tell us a little bit of that before we go, and we'll link to these in the newsletter as well?
Sure. So related to engagement, I like to encourage people to check out, actually, which we didn't talk about too much today, Your Next Shift, the podcast I host. because I do interview nurses from all different walks of life and lots of different specialties and backgrounds. The premise of that show is to really show nurses out there listening, if you're feeling stuck, if you're feeling plateaued, if you're just feeling frustrated by the role you're in and just need some inspiration, the podcast is a great place to check out. So again, that's called Your Next Shift. And a lot of what I talk about in that podcast, the community, and the book that goes along is about engagement. I shared honestly with you, Monica, and the audience that I'm in my own burnout. I've been focused so much on burnout and that negativity wrapped up with it that I'm burning myself out on burnout. So I do want to focus more on nursing from within, Your Next Shift, those places that are uplifting for me that I can help others with that content related to engagement. So those would be the best two places to find me.
Great. So we will link to them in the newsletter. We'll put a little sample of your podcast there as well so that everybody can get to know you and get to know all the services you offer. And thank you so much for joining us today and for your time. Really appreciate it. And I think we're all going to get such great value out of this conversation.
Oh, my pleasure. Thank you for having me, and for you for putting this out to your audience, and again, for all that your nurses are doing for patients. It's awesome.
Thank you so much.